We have a study where we're looking at circulating tumor DNA testing in prostate cancer patients, so that's also known as liquid biopsy. This is a kind of testing where you draw the blood and then you look for cancer, a DNA that's actually shed into the blood plasma, and then you can actually measure what's happening in a patient's tumor by just taking a blood draw. This is not related to diagnosing if you have cancer or not. It's these assays are designed towards people that we already know have cancer, and then finding mutations in that cancer that are useful in guiding which therapy you choose for precision medicine. What current assays are looking at for the most part right now in commercial space is just that liquid portion, just the plasma, and that is where the tumor DNA is when you're looking at a cancer patient. The problem is that there are mutations that can be coming from those blood cells that also get into the plasma that are not related to the cancer. And so we're learning more and more. There's a phenomenon called clonal hematopoiesis, or also known as clonal hematopoiesis of indeterminate potential, sometimes abbreviated as CHIP for the acronym. These two drugs were approved based on genes that are frequently mutated in prostate cancer, these so-called DNA repair genes like BRCA2 and BRCA1 and ATM. Those same genes, unfortunately, are also mutated as part of clonal hematopoiesis. About half the time when you find a mutation in the plasma that would guide therapy with these new class of drugs, this PARP inhibitor, about half the time that's from clonal hematopoiesis and not from prostate cancer. So if you don't think about this problem, that means that half the time you're going to basically tell a patient you should use a drug based on something that has nothing to do with the cancer, and basically it's a clinical false positive result half the time. So the good news is it's actually quite simple to solve this, and what we do here at UW Medicine and Brotman Beatty is we do a control where we look at the blood cells where the clonal hematopoiesis is and the plasma. We look at the sort of paired control. And so the good news is by looking at the blood cellular compartment, you can tell with pretty good certainty whether something's cancer or something is the hematopoiesis.